Hello. I hear we're having some issues with our shoulder. Is that correct? Do you mind if I take a little look at it? Alright, so I'm just going to move your arm towards me here. Let's see what we've got. You'll have to excuse the little tings and creaks. It's been very cold, so the pipes are expanding and contracting, the heat and the cold. Tell me a little bit about your symptoms here, where you think you might have gotten any of these symptoms from, specifically what it feels like, what makes it better, what makes it worse. Let me know if any of this is painful. This one is, okay. Just tell me a little bit about that. I'm gonna come a little into the chest here. I want to work a little medially here, come in, see, along the clavicle, about right down here, a little bit. Okay. So you're not specifically sure what happened. It might be some overuse, maybe. Okay. Right, well, you could see we'll get a little bit to like the deltoid here, the biceps, anything with these. Okay. Alright. Well, palpation is only going to get me so far into figuring out what we need to do. So I would like to do some testing. Before we get into that, I want to talk a little bit more about what we're going to be doing. So, the shoulder. We're going to go back to advanced biology for a minute. The shoulder. First off, what is the shoulder? This is called the glenohumeral joint. Great fact for parties. But what else do we have in here? It's not just this joint, but we also have the acromioclavicular joint as well. As far as bones go, we have the humerus, we have the scapula, we have the clavicle. Now, in terms of muscles, we have our main rotator cuff muscles. Rotator cuff. This is going to be supraspinatus, infraspinatus, subscapularis, and teres minor. Alright, just 4 guys. Fairly easy, right? Not so much, because there's a lot of others. What else do we have in this area? We've got muscles like deltoid, teres major. We have pectoralis major. Ooh, there we go. Well, that one looks a little weird. Pectoralis major. We've got rhomboid minor is on top, rhomboid major on bottom, levator, scapulae, and really I could go on. There are more. I mean, we have subclavius can get in there. We have coraco brachialis helps a little bit with the shoulder. Biceps brachii. I mean, there's just a lot going on. We could even get the dismus dorsi. There are a lot of different moving pieces with the shoulder. It's not just a joint and the rotator cuff muscles. It's this whole network of structures. So, what are we going to do about it? NeuroKinetic Therapy, NKT. This is what we're going to be working with. So, this is a manual therapy that has roots in a couple different things. We have applied kinesiology and motor control theory. Okay, so this was developed in 1985 by David Weinstock and his colleagues et al. And where this motor control theory comes in is that it is this thought that movement patterns are created and stored in the cerebellum, the little brain, in a place called the muscle control center. So your brain is very smart and also very dumb. So normal functional patterns are created just as well as not so normal dysfunctional patterns. If something goes wrong with movement, your body has a smart idea to try to compensate for that, to try to make it work using a different method. Where it's a little dumb is sometimes those methods are really bad for the muscles it chooses to compensate. They're not supposed to do that. They will, but it's going to cause pain, restriction, it's going to get all jammed up. So what we want to do here, we're trying to address these dysfunctional movement patterns, get to the root cause of it, and address it from there. We're trying to undo those stored patterns because we could come in with massage, stretching, we could do all sorts of techniques, right? But the body may have a tendency a few days later to go right back into the pattern that caused the pain in the first place. So we're trying to get to the heart of the issue and resolve it from there so that it doesn't perpetuate. So how do we do this? We identify dysfunctional movement patterns by manual muscle testing. But unlike normal manual muscle testing, we're not just testing the muscle in one spot. Because when you do that, sometimes the muscle might seem like it's functioning fine. Maybe it's on the border. But if you test it in a different way, then it's a lot weaker. Then we have a little bit of a problem. So we're going to do this with multiple positions and rotations so that we can really get into what muscles are causing a problem for you, getting that all fixed, and then hopefully you won't have to come back after a couple of sessions of making sure everything is back to normal. How this process is going to work: we are going to test, manual muscle testing. We are going to treat, and this could be in a variety of different ways, just depending on what we're working with, and retest to make sure that everything took. We have a special way of doing this treatment here, so that we replace the dysfunctional movement pattern with something more functional, the way that it's supposed to be, right? We'll get into that a little later. Does this make sense? Does this sound like something you want to do? Wonderful. So we're going to start right here, the manual muscle testing. So we're going to do some while you're sitting here in front of me. We'll do some with you lying on your side, lying on your back. We are looking for multiple planes of movement and positioning. So with this arm here, I want you to raise your arm in front of you so that your palm is facing the back wall behind you, and you're going to go up as far as you can, right? You could do that. Okay, and at what point does that hurt, if it does? Okay, let me just take this. I'm going to very passively here bring the arm up, and right about here. Okay, good to know. And then I am going to have you go out to the side and above the head. Okay, and is there a point where that is painful? Do you feel any restriction? Does it feel like anything's sticking? Okay, right about. So if I take your arm and move it right about here. Okay, so if I come down a little, this isn't painful. Maybe a little sore, but then past here, right, and then going all the way up. Okay, good to know. So, let's go ahead and look at the acromioclavicular joint for a second. If I could have you take your hand and put it on your opposite shoulder, let your fingers wrap around the shoulder and are touching your back. Okay. Tell me how that feels. Any particular issues with this? Okay, so yeah, let me just go ahead and passively do this. So I'll just bend the elbow here and put the arm right there. Okay. So here, I'm just going to okay. All right, and now for the scapula, I want you to take your hand and try to put it as far up on your back as possible, trying to get to the opposite shoulder blade. You do that? Take the hand, put it behind your back, try to get as high as possible. Okay, we get a little bit in there. Okay, that's good to know. So, I am going to have you lie down on your good side so that we can work with this painful shoulder. All right, I'll give you a second. While you're on your side here, I am going to have you keep the leg that's on the bottom straight, but I'm going to have you bring up the top leg and tuck your foot behind your knee. And then we're going to do some rotation with the arm here. I am just going to lift your arm and tell you a little bit about what I want you to do. So we're going to start just off the hip here. I'm going to have you make a full circle around the head, coming back to where we started. So if you could do that real quick, just do this rotation around. Okay. Good. And now if you could do that, but the other way, so backwards. Okay. Excellent. So tell me about what you feel in here. Okay, so if we come right here, that's when it starts, and then here, and then, how about right here? A little bit better. Okay, so I am going to have you go ahead and flip onto your back so that you're face up. We're going to do some passive range of movement testing now, right? Okay, so I am just going to position you here. So we are going to have the upper arm perpendicular to the body. I am going to have this partially off the table here, so your elbow's off, and I have your forearm sticking straight up. We are going to test internal and external rotation here. I am going to support both your upper and lower arm here. We are going to turn in for internal rotation here, and then come out for external rotation. Tell me about what this feels like as we're going externally, internally, external, internal. Okay. Let me bring your arm straight out here. We are going to work with abduction here. So, arm straight out. I am just going to be moving it above the head from this position. Now tell me if this right there. Okay, so I'm going to keep going. Tell me if it's too much. I'm going to bring it back down. Okay, I'm going to try that again. I'm going to come a little lower this time. And then go up and right there. Okay. Come up. So you can come up all the way. It's just not very fun though, right? Yeah, not so much. Okay, let's bring it down then. Okay. So this time we are going to have you do it actively. I'm not going to be guiding you, but you're going to do it yourself. So, arm perpendicular, do internal, external rotation here, all right? Start right here, internal, external, internal, external. Okay? How does that differ from the passive range of movement, if at all? All right. Now we're going to put your arm all the way out, and we're going to have you abduct the arm and bring it back down. Abduct, bring it back down. Right in here. Abduct. that same sort of painful threshold right there, but you still can get it to go all the way up. It's just not the most fun thing in the world. Okay. We are going to do some specific manual muscle testing. I'm going to be working primarily with the rotator cuff muscles. We talked about those a little bit earlier. We're going to see what kind of patterns your brain has been storing. We're going to see what we can fix, what we can get working much better for you. All right? We're going to start with subscapularis. Upper arm perpendicular to the body, forearm straight up, and I am going to have you press against my hand. So I'm going to be holding your wrist here. Now have you press against my hand. So if you could just press in here. Good. Good. Okay. I'm going to be testing this. We're going to come down here. I'm going to still hold the arm. We're trying to test in multiple rotations here, multiple positions, because maybe subscapularis is on the borderline right here. Maybe if we move right here, suddenly it's weaker. Maybe if we externally rotate, maybe that's weaker. We want to try to tease out the little clues that something is not working correctly. So we're going to do the internal rotation. Go ahead and press against my hand here. Okay. Good. We're going to externally rotate. Go ahead and resist me here. All right, good. I'm going to move your arm in a little bit. We'll tuck your arm at more of a 45-degree angle here. And we're just going to have you press against me here. Good. Okay. So how does this feel for you? Does it feel difficult? Does it feel weak at all? Okay. So infraspinatus. We are going to have the arm up here, forearm straight up, and this time I'm going to have you press backwards against my hold here. So instead of holding the wrist, I'll be holding at the back of the hand, back of the wrist. So if you could press back against this. Okay, pretty strong here. Good. I'm going to bring your forearm down here. We're going to try that again. So push up against me. Okay, and what if I bring this back a bit? Now go ahead and press back. Okay. Might be a little more difficult here. Good. Good, okay. For teres minor, I'm going to bring the arm in towards the body here, and I'm going to have you press backwards against my hand here. Go ahead and press here. Good. Let's do that again. Just go ahead and press back against my pressure here. Okay. All right. So, supraspinatus. I have the arm straight out. I am going to bring this a little bit at an angle and bring it up just a little here. And I am going to have you try to press out against me. We're going to try to do some abduction here. So if you can try to press out. Okay, maybe not so much. A little bit. There we go. Okay, try to press out against me. Okay, there we go. So past a certain point, we switch to the middle deltoid. That's going to be the big mover here. So I'm going to move it past that point. We're going to do that again. We're going to try to do the abduction. I am going to press against you. You're going to try to resist me here. All right? So I'm going to hold my hand right at the back of the arm here, back of the wrist, and try to move your arm up. Nope, not so much. Try that again. Reposition here. You could press against me. Okay, let's reposition. And is this any easier, trying to press against me? Okay, not so much. So, middle deltoid here. We have got some issues. So, let's go ahead and start working a little bit with treatment. So, we have about a 30 to 60 second window between the muscle failing, the brain saying, whoa, what was that? What do we need to do here? Giving the body the instructions to make that a successful movement, to make it a functional pattern, and then we want to hold that in. That's what we want the brain to remember. That's what we want to store. So, I am just going to bring the arm out to the side. We're going to focus on supraspinatus. I'm going to do some palpation in here. And tell me a little bit about what's going on here. I want to find the right point. So what we can do here, just going to find that spot. It's right in this little groove here, this little depression. And I'm going to have you abduct the arm against my resistance here. We're going to see if this is from an overactive supraspinatus. So if I could have you press against my hand here. Okay, and how was that? Yeah. So, depending on the kind of main profession that someone has, a bodywork professional, let's say they work in chiropractic. Maybe they're a massage therapist. Maybe they're a physical therapist. There are many different ways to get this to release. What we want to do here, what's going to be very easy and something that you can do as well, this is a good exercise that I'll have you do. I am just going to have you pull the arm kind of up. We're not just stretching it, but we're pulling it up and over. And the hand is going to come by the opposite hip. So I'm going to just move this over. Make sure this comes up and over. It's not just in this straight line with the rest of the torso, but being brought forward. And we are just going to hold right here. So how does this feel? Right in here. Yeah, it's a very simple stretch, but this is going to help release this. And we're going to just keep holding here. This is where we get that little window. This is the area that shouldn't be working as hard as it does. That's the thing with the body, is it tries to find a way, right? Not always the smartest way, but the way that works. Let's just go ahead and take a deep breath in and out. Good. We'll bring this back over. We're going to retest that. We're going to see if that took. We're going to see if we need to do any other work here. So, arm just off the hip. Elevate it a little. I'm going to have you try to move your arm out and press against me here. Good. What does that feel like compared to before? Okay. We're going to bring this out to 90 degrees here. I'm going to do the same thing. Try to move your arm up. Resist my hand here. Okay. And what do we got? Okay. Strength looks much better here, but you're saying there's something else that is going on here. Tell me a little bit about that. So we have the sternocleidomastoid is going to be one of the big ones in this area, but then we also have the trapezius on the lateral part of the clavicle here. So I'm going to feel around here. Tell me where this is at. I'm going to start more at the sternocleido and work out to trapezius. Okay. Alright, well, that doesn't surprise me. Let me go ahead and just feel around in trapezius. So this is one of those many muscles that can get caught up in here. We went through everybody. There are just so many. So it would have been more surprising had there not been someone else we were having an issue with. Okay, so here I want to test the rhomboids. So we are going to bring the acromioclavicular joint upwards. And this arm is going to come almost to 90 degrees. Forearm straight up. So do something like that, okay? And I am going to have you try to bring the elbow in towards the ribs. We're going to do some adduction. So keep right here, ACV up. Try to bring the elbow inwards. Okay. Alright, so let's try that again. I'm going to tuck the arm in right against the side. I'm going to slide my hand right between your rib cage and your arm and try to push in towards me again, or in towards you rather. Okay, I am going to have you try to bring your shoulder up towards your ear. Okay, and then hold this right here against me. Better, good. Now bring that shoulder back down and try to hold against me. Okay, that's our failure there. So I'm going to put the arm against the side here, and I am just going to have you press your shoulder up against my hand, right in here, and we're going to hold this here. So your arm will be up, I'm going to be pressing down, we're going to hold this. Good. So we're going to do this hold, and then we're going to do a little stretch. Okay, and we'll take a deep breath in and out. So, in terms of stretching this out, I'll have you just hold your arm out, just keep that extended, and I'm going to have you turn the head, and I'm just going to do one of these. We'll open this up, okay? So, we'll turn the head, and just going to hold this and the shoulder. We're going to get some good length in here. A little bit more. Let everything just start to relax. Loosen up. Get a little bit of length here. Deep breath in. And out. There we go. How does that one feel? That's a good stretch too. So let's go ahead and test this. I'm going to have you shrug against my hand here. Okay. I'm going to keep the elbow at the side. Forearm comes up. I am going to have you try to bring the elbow in here, hold against my hand. Okay, that's a lot sturdier than it was. I'm not just moving y'all around. So, what I want to do here to finish up, I want to test the arm abduction and the external rotation. We'll see where we're at in terms of pain, because that's what we were really struggling with, right? So, a little under 90 degrees here. I want you to bring that arm up, okay? Good. How was that? Better. Let's do this passively. So, arm right here. Bring that up. Okay, and any sticking, any areas where it's still pretty painful. Okay, external rotation, upper arm 90 degrees to the body, forearm up. We are going to externally rotate. This is internal for me, external for you. So we're going to move this way. Okay, and again. And again. Okay. Can you do that for me then? Move that out. And how's that feeling? How's everything in here feeling? Okay, good. Well, I want you to keep an eye on that. See if there are any new sensations that pop up. Sometimes when we correct a pattern or two, the body might find some other ways to get a little goofy, and we'll want to work on those. I am going to be giving you some specific exercises so that we keep the body from going right back into that other pattern. All right? So I'll see you in a sec. Let's go ahead and sit up slowly as you need to. We have been working on you for a while. Just make sure you don't get lightheaded or dizzy, okay? Alright, see you in just a sec. So, I've got a few sheets. Let me just take a look. So, these are going to have some specific exercises listed on them so that we can keep everything from acting up again. I'd like to see this one, so just a couple, and they're not too crazy, but it is important to keep up with them, and it feels like you're doing it a lot of times a day. I mean, one of these, I think, so this is 3 to 4 times a day, this one's 5 to 6. It is much more preferable to do these little bursts several times a day as opposed to one long session once or twice a day, right? We want to just do these little bits. So these are for you, and I think we will give that a week, see how it goes, and you want to come back in and we can take a look, see if those movement patterns held and if anything else is acting up again. All right? Do you have any questions for me? Wonderful. Well, I'd like to thank you so much for coming in for this NeuroKinetic Therapy treatment. I hope you have a